So it's my pleasure for our final session to welcome Barbara Harpham from the Medical Technology Group and Daniel Jones from Stryker.
Good afternoon, everybody. Yes, I'm Barbara Harpham, and I'm the chair of the Medical Technology Group. This is Dan, who is the Government Affairs Director from Stryker, and Dan is a long-standing member of the Medical Technology Group in various guises along the way, and currently is one of the industry members, but he has been involved with the ABHI and lobbying on our behalf of the MTG. I don't need to tell any of you here today about the complex landscape of innovation in the NHS. It's not easy, but by the end, I hope that we will have a better understanding of the various government initiatives, which Dan will go through, that will support the introduction of innovation to the NHS and will help you to introduce and extend the adoption of your own innovation. Along the way, I'll tell you about the Medical Technology Group, which I chair, and how our work has focused on improving the landscape with the emphasis on the patient voice all the way through. One of the nice things about my role as the chair is I get to places like this and meet people like you who are actually there, and that I hate this expression, but at the coal face, but you are trying to get innovation into the NHS. And I meet people from both within the NHS and DOV and all of them, and from outside as well. So as MTG, we see it from both sides. And here today, I mean, there are so many different things when you go looking around and people to meet, and you're a really lively, I suppose, ecosystem of people who understand all the problems of bringing innovation into the NHS, and also the problems facing the healthcare system at the moment. And let's face it, how we can best to bring the best innovation to the people who matter the most, and that is the patients who deserve to have the best healthcare that they can have. In the recent years, obviously because of the problems that we've been having, we've seen medical technology as being the thing that has delivered the benefits and provides the solution to many chronic problems. MedTech is really important, and it is the main way that things have been changed and innovated. The good example of this is diagnostic capability, surgical waiting times, the need to treat people outside of the hospital in their own homes, and in almost every case, medical technology has been the way of ensuring that and making that happen. The MTG as an organisation was founded in 2001, so we're 22 years on. So we've got a lot of experience, and believe me, we have seen all things come and go. And Dan especially has written report after report on our behalf on things that, initiatives that were going to be there, and all of a sudden, oh, they've gone, or that committee's been disbanded or whatever. And we've actually tracked this over these 20 years in various reports. But what we have seen, there is a rise in patient-focused healthcare and through technology. And we know that the most appropriate use of medical technology ultimately reduces health spending, because at the end of the day, that's what the NHS want. They talk about value, but what they want is the cost coming down after all, and that's what they want. But what they don't take into consideration is the societal benefits that it can bring. It's not just bringing the cost down. It's, getting your independence back, being able to go back to work, look after your families, live a better life, a longer, healthier life, through what we're seeing more of, medical technology enabling this. And it will lay the foundation of a better healthcare system in the future. Oh, sorry, I'm on the wrong one here. We've also tested those NHS hospitals and the regions who are innovative in their approach already. And for quite a few years now, the Medical Technology Group has watched national performance through the analysis of regional data. I suppose you want to call it the postcode lottery of where you can get to. And we've done this analysis and we call it the Ration Watch campaign, which has been going for some years now and is still ongoing and becoming more and more relevant all the time. As our latest report found, lo and behold, the ones that cope best with the crisis had built a carer system based on implementing the best medical technology. Post-pandemic, thank goodness, there are signs that the government and the NHS are realising that the best available medical and data technology can truly transform the NHS. And it can become the modern healthcare system which we all deserve and should have. The new integrated care systems, which we all know what they've been called before, but currently integrated care systems, if they're to succeed, it's likely they will become increasingly reliable on the implementation of good medical technology, especially in data. And this will allow them to fulfill the goal of having preventative medicine, which is what the government wants, is to stop it even starting, and to them to build a model of healthcare which is built on keeping patients out of hospital and making the best possible use they can of patient data. The government's latest medical technology strategy shows that it is open to the wider uptake of innovation that will help tackle all the problems within the NHS needs, and with a push towards a standardised way of collecting patient data. I mean, it's mad, isn't it, that GPs can't talk to the secondary sector. The secondary sector, mad, absolutely mad. But there has to be a push towards this, because data, this is where the test the efficiency of medical innovations for patients and clinicians alike, is the collection of data. Thanks to the relationships we've forged across the NHS, the Medical Technology Group, government and the Department of Health, our Medical Technology Group is about to enter one of its most important phases yet. And I've been chairman, 16 years, something like that. And I've been through all sorts of things. But this is a really crucial time for us. We now are the people, or the group, that all the groups I've mentioned come to. They ask to see us now. We have a quarterly meeting with NICE. We're talking to Health Watch. We're talking to the MedTech Directorate, because they have asked to talk to us as a group. And that's because of the reputation that we have built up over these 20 years. This means that the members of our group have the ability, to meet with these people on a personal basis and to attract the attention of key decision makers, so we can make change happen, including now in the ICSs, as well as with the government, and helping the government to fulfill its strategy. I'm very proud to say that we've had a lot of very notable campaigns as well that have worked with all these people, and from treatments for medical thrombectomy, more equitable access to hip and knee surgery, to the greater uptake of technology to manage diabetes. When you talk directly to NICE and just say, do you realise that you have said that people should have an insulin pump and they don't have them? You need to know this. It's something which you recommend. It's not happening on the ground. And so we have these channels now that we can talk to them and give them real life data and real life case studies. In 2017, this report, this I keep saying about where we said things come and go. We did a report called Deja Vu. Already seen and seen and seen, sort of thing. And that we send out reports to ministers, MPs, key decision makers, and they now read them. And because of that, we've helped NHS leaders understand how previous medical developments and initiatives have failed to properly be innovated in the NHS and not used. Since the pandemic, we've also done the backlog briefing, and it was used to inform key officials on the best course of action when it comes to adopting technology. I've no need to tell you that the road to adopting technology is very rocky. There's no one door that you go to, and there needs to be better ways of getting your technology there. Looking to the future, we're working to highlight the benefits of a new way of using data technology that has helped one hospital treat 3 times as many patients than other NHS reasons. The thing that baffles me all the time is that you have this beacon pathway, if you want to call it that, and it's used by one. Why aren't they all using it? Don't they all know about it? The NHS just doesn't talk to each other. It's just mad. But there are these things that are using medical technology, and through medical technology they are changing. And it's one of our jobs is to highlight that. And how do we do this? Well, the secret of our success is the spirit of collaboration that we have in our members, from industry, patient groups, and the representatives of the NHS that the medical technology brings. We're seen as thought leaders in this space, and we're best positioned to respond to the most pressing concerns in the world of medical technology on behalf of our industry members, and importantly, patients. They seem to get lost along the way. The NHS is there for patients. What input do they have into all these decisions? And where is their voice heard? And that's one of the things that we bring. We bring in our group the patient voice. All of our work ultimately reflects the wide interest and expertise of our member. And people underestimate the expertise in charities. For example, my background is in medical research charities. We have a wealth of case studies, of real world information, and I never got talked to by the NHS, ever. So this is where the MTG brings all these different people together. And by being part of these discussions, we mean that we bring your voice of the industry and concerns to the potentially a new era of healthcare. In turn, we'll keep using opportunities to better inform key NHS decision makers and meet the needs of patients. I think I'm way behind here, but it doesn't matter. Patients. I want to focus on patients as I come towards the end of what I'm going to say at this point. Ultimately, technologies succeed on how well they understand the needs of patients. Insights from patient groups and research charities on a wide range of on topics and conditions, from heart failure to diabetes and wound care to women's health, add a very important element to our understanding and appreciation of the real world from within the MTG. We use that. Not only is this an opportunity to raise concerns on patient groups, research groups, industry's behalf, but a chance to pass on and help adapt the changing healthcare landscape, but with patients at the heart of that. For medical technology to succeed in this new age of healthcare, we must make this patient voice heard. Innovating and providing care to patients in the home and outside of hospital will only work if we involve them in the process. Data is power. It's going away from it. Knowing what you know is power. And it gives understanding, opportunity, and above all, the power to change. Gathering data on what works well is part of the challenge, but so too is understanding patients' needs. I'll deviate for a minute because this is a bit of a bugbear of me, but how many times have you looked at the NHS and thought, you haven't changed a bit? Even after the pandemic, I had great hope. You know, during the pandemic, all sorts of things happened. You thought, oh, it's great, you know, they got this, we got that, you know, and things happened. So I thought this will continue after the pandemic. It's going to be great, this. And what's happened? It's nosedived again. And it's because the people, I'll be contentious and honest, it's the people within the NHS will not change. And it is further down the chain that you get, they do not want to change. I mean, as I said, we have all sorts of meetings with people very high up in the NHS, and I've been so inspired by the drive that they want to change things. And that's when you get deja vu reports that say, you know, there's all these things put there to change, and by the time it filters down to the bottom, it goes. And that's what needs to change, is the culture within the NHS. That is the biggest obstacle to the implementation of medical technology. This is my belief, anyway. The development of patient conditions over the long term, it's complex, it's multifaceted, and each patient is unique, but only they truly understand the day-to-day needs of their condition, how medical technology can help them, and therefore each patient brings experience that ultimately is an asset to anyone seeking to help the NHS transform healthcare. The Medical Technology Group is made up of patient groups, patient charities, research groups, people who are interested in medical technology that can bring special skill, expertise for us, and importantly, industry. So we have a wide coalition. We are unique in what we do. So that's why the medical technology has got this voice, because we can speak on behalf of you know, multifaceted approach. I hope the introduction to the medical technology has inspired you and encourages you to champion your role as industry to play a future in healthcare. I also hope that it's got you thinking of not only what can you learn from us, but what we can learn in bringing innovation to the NHS. Now, let me have a look. I'm now going to play a short video, and it shows you how medical technology can benefit patients, but also to give you a better idea of our work and highlight its importance amongst key stakeholders. Then I'll hand over to Dan, who will explain in greater detail how to navigate this new exciting landscape of medical technology.
Former GB water polo player Dean Walker, flanked by his nurse and doctor, is living proof of what medical technology can achieve. Suffering debilitating back pain after a work accident, he was eventually fitted with a device that prevents pain signals reaching his brain.
Since it's been implanted, like I say, I don't feel it there, and the pain did disappear literally straight out of surgery.
His doctor, like many medics, believes that the government could do more to speed up the introduction of new medical technology.
The saving would be mainly of utilization of the healthcare, reducing the medication, which can be very costly, the pain intervention, which is enormously costly, as well as avoiding any necessary spine surgery.
At Parliament, the influential Medical Technology Group, a coalition that unites clinicians, patient groups and industry, urged MPs and peers to support calls for better access to medical technology.
It can bring efficiency and savings, which is what the NHS should be aiming for.
Parliamentarians from all parties signed the group's pledge, urging the quicker uptake of medical technology. Joe Wennell and his mum, Christina, don't need to be told about the benefits. It saved Joe's life when he suffered a stroke. The latest stent retriever was available to pull the clot from Joe's brain.
When I went into the operation in the theatre, I couldn't talk at all. And afterwards, I could count to 5. I knew who my brother was. Because all these questions that my mum was asking me, I couldn't answer beforehand.
The medical technology group believes that everyone deserves the same chance as Joe.
So now I'll pass over to Dan, who will tell you about his slides.
Oh, thanks, Barbara. Hopefully you can all hear me. So just to introduce myself, I'm Dan Jones, Director of Government Affairs at Stryker. My role also covers market access, so on a sort of daily basis I'll be interacting with NICE and trying to navigate our products through the complicated landscape that I'm going to talk about now. And just a point on that, working for Stryker, people, when I talk to smaller companies, they'll say, well, you work for this large global company, one of the top 10 medtech companies in the world, and you have access to unfettered resource, it must be quite easy. And the reality is it's not. We've got around about 100,000 products. I think we're getting up to sort of 150,000 these days. And we have to take decisions on where do we invest our resource, which products do we focus on, can we navigate the system, will it work? And I think the reality for me is if we make mistakes, Stryker probably won't go bankrupt, but I've probably only got 2 or 3 mistakes before I lose my job. So it's quite important that I'm able to navigate this system and understand and help Stryker make the right decisions of where we do that investment. So just a look at the chart in front of you, and this is actually produced by the MTG a few years ago. This was made in 2019. And what we were trying to do was look at all the innovation support mechanisms that had been implemented over the last, how far has it got? Yeah, at that point about 15 years, now almost 20 years. And look at the ones at the top that were still in existence after however many years, and then the ones at the bottom that had come and gone and had lasted for some a few years, some a bit longer. And what we found was there were quite a few that had been set up and quite a few that had then disappeared. There's a lot of different avenues you could take as an innovator to try and take your product forward. But what I think was quite interesting, I hadn't looked at this for a little while, and it was only when I came to do these slides that I realized that actually quite a few of the bodies on there have also gone as well. So the Innovation Accelerator is actually still around. I didn't mean to put a line through that, but the NHS scorecard is pretty much defunct. Commissioning through evaluation is now gone. Health Tech Connect has changed into something else. NHSX has become part of the NHS Transformation Directorate. So there's actually been quite a significant change over the past 12 months, I would say, in terms of what are those structures that now exist, what was there before, and where you might want to take your product. So just focusing on that for a second. So Health Tech Connect, you may know it, it was the idea of a sort of single front door for the NHS, for innovators to bring their products forward. That has morphed into the NHS Innovation Service. So if you're not familiar with that one, that's probably, that would be the first port of call for me, and often is with our products. So that is just, it's a web portal, you can log in, put details about your products on there, so it'll ask you a series of questions that you go through about some of the regulatory designation, information about the purpose of your product, the current usage. It'll ask you for the amount of data and evidence that you've got in terms of published reports. You can upload that up onto the innovation service, and that then is broadcast to a number of organisations across the NHS that can then provide you support. So what normally happens is, and I've been through this a few times, you put it up there, within a few days you start to get responses, AHSNs and others will come back to you with questions, and you start to find those partners within the system that can help you navigate through. So that's quite a good one. Also up there is the Academic Health Science Networks. So these are 10 years old this year. For those of you not aware, they are 15 regional organisations that are aimed to support innovators, large and small, to engage with NHS organisations to drive uptake of products. They've been relicensed for another, I think it's another 5 years, and they will be turning into the Health Innovation Networks. Again, I would recommend, wherever you're based, it's probably worth reaching out to your local Health Innovation Network, AHSN, getting to know them, to understand the connections they've got, to understand what they can do to help you put your product through, because there is a process there, and actually, a set of organisations with staff that can can help you drive this forward. Other newer initiatives is the Innovative Devices Access Pathway, which isn't on here, because that's quite a new one within the last 18 months, and that is principally held within the MHRA. The idea being is looking at devices as they come through into the CE marking or UKCA marking process and creating that pathway that takes a device through the CA process. Once you get that marking, to take it into the market and then to help innovators navigate the system and take it through in a way that is actually going to meaningfully pass through from one organisation to the next. The final point, which again is up there, so the NICE MTEP program, some of you might be familiar with this, that's the MedTech Evaluation Pathway. There's quite a few changes underway at NICE. They've got new leadership in Sam Roberts last year. They've got Mark Chapman now, who's head of the devices team. There's some significant movements going on through NICE. So the MTEP will continue in practice, but I think its name will change. And really NICE is looking to consolidate the number of products it offers for medical devices. So if any of you have tried to engage with NICE, you've probably found there's a lot of different things you could do, an interventional procedure guideline, a medtech innovation briefing, go through the MTech pathway, go through down and try and get some medtech guidance, potentially get some diagnostics guidance, depending on what your device does. Could you go for a full HTA? Quite complex. So what NICE are looking to do is to consolidate that into a more single pathway. So the outputs might be slightly similar in terms of the level of impact, but rather than have a series of quite complex products that no one really understands anyway, they're seeking to consolidate that down into one. Secondly, they're also looking to move more to a set of multi-tech appraisals. So rather than looking at individual devices, they're now going to take a look at a category of devices. So, if your product is a new and innovative pacemaker or ICD, what they would do is rather than look at your product on its own, they would seek out similar products from across the market and see if they could look at a category of products and produce guidance on those, which I think is a positive step. There's some complications around how that would work in practice, but I think overall taking that approach should help innovators across the piece. So that was kind of where we are, and on that slide, we're updating this report and should produce a new graphic that will show how the number of organisations have transitioned into a new landscape with more red lines at the bottom and hopefully fewer green bars across the top. So in terms of how the NHS now approaches innovation support, this is a graphic that was produced by the Accelerated Access Collaborative, and it looks across 5 areas. So creation, development, evidence regulation, commissioning and adoption, series of steps, and again, it's not a perfectly linear pathway, but these are all the areas that the Accelerated Access Collaborative, as the body that's nominally focused on looking at these things, these are the various pieces of that puzzle that you need to focus on as you move through this pathway. And I think what is quite interesting, we do see the support mechanisms are now gearing towards those 5 areas. So there's quite a lot of support for the initial creation, development of devices, that the sort of the real innovation phase, and I'd probably count that as the pre-CE marking phase. There are a lot of organisations that can support innovators to gain additional funding for their devices and take it through. Then as you move through into the evidence regulation and commissioning and adoption phase, I think it gets a bit more difficult. There are fewer organisations to support with that, and we start to see the process thinning out. So I just wanted to show this, and this is trying to map my way through it as to which way might you go if you have a device, you've got your CA mark, and I think starting at CA is probably reasonable. What's that plan? And the reality for me is it's not a linear progression, and I don't think it ever will be. It's not going to be that you'll take 3 steps and you'll find yourself at the end. Actually, you'll probably end up looping around, speaking to different bodies, getting sent back. But if you did go through the innovative device access pathway, you'll probably get routed into the innovation service. They might say, oh, well, actually, you probably need more evidence, and here are the areas that you need to look at. That will then route you potentially into the NIHR to go and set up some studies, gather more evidence, potentially looping you back round to the innovation service, maybe into the IDAP portal. Once you go through that, you'll probably end up back into NICE somewhere, speaking to them, finding out whether they can help you. Now, NICE might say, okay, yeah, you're good enough, we'll give you an MTEP. They might not. They might find, actually, you know what, we're going to put you into the early value assessment program that will help you develop that evidence. So that pushes you back probably into the NIHR to go and talk to them about establishing some studies, to loop back around, to find yourself back to NICE, to try and get an MTEP, to finally try and get the medtech guidance, which is, or whatever guise that takes. And then the final step, if you are very lucky, is the medtech funding mandate, which is the only real piece of support for medical devices that offers funding. So those of you that aren't aware, it's a government-funded scheme, and what it does is it ensures that devices get funding. It's not a funding pot. What it is it's a mandate for funding from commissioners. And that only comes once you've got a piece of medtech guidance. And there are only 11 technologies that have that. So it is quite difficult to get on, and we're not sure if that's going to get extended out. Sorry, I can see there's a clock ticking in, and it tells me I've got a minute and a half to go. So just the final thoughts from me. The system's not linear. It's not going to be a clear progression where you go step by step and you keep moving forward. You will find yourself coming back. But I feel it's becoming clearer. The moves to consolidate the number of organizations is working. I feel the innovation service is quite an effective way of getting people in and routing them into the right place. Funding, there's still a lack of funding. There isn't any real initiatives that guarantee funding for innovative devices. NICE is still challenging. There are still different pathways. It's still not always clear the level of evidence required, the process. You're still beholden to committees and you're working your way through there. The transition between different organizations and bits of the systems is still a problem. You'll still, people fall through the cracks. It's difficult. You don't know if you're going to get moved around. I still feel there's an element of picking winners. The system wants to find this one device that's going to change everything, that's going to revolutionize the world. In my view, that doesn't exist. There are lots of devices out there that have many different applications, and trying to find one that's going to change everything is very difficult. And then the final point from me is that there has been a new review announced. It's by Roland Sinker, who's from Cambridge Hospitals, and it's looking at the innovation ecosystem review. So we'll hold our breath and see what that produces. Thank you.
As I said to you previously, where I'm from is a medical research charity, and I chair a group of medical research charities and patient groups that come together to try, an industry, to try and get the uptake of medical technology in the NHS. I feel sorry for people like Dan and you. I really do. I mean, I get drowned in acronyms for a start. And at the end of every meeting, I'm saying, what was the so-and-so again? And I've lost track already. But that chart, you said there's a current flow. It's a current maze. It's not a current flow. It's a maze. And it just beats me why such an organisation has allowed this to go on for so long. It's just ridiculous. But that's where people like us and the medical technology group, as a really, to be honest with you, we are quite powerful now in that we get to see the people. We put these points across and say, why are you allowing this? Why are you changing a name of something and putting more money into it? And it goes nowhere. But the one thing that I can say over the last probably 2 years is that at last I have hope. I really do. Because the people that we are talking to at the moment, who are, the top people in the NHS and the Department of Health, that there is such a will to change at that level. There really is. And now money is coming through. Money is coming through to back things. And it's up to us, as the MTG, on behalf of the industry and everybody else, to make sure that the people who make these decisions are actually spoken to in real life language and terms, and put patients at the heart of the whole thing. Because at the end of the day, it is the patient that you are treating. You are not paying wages for people just to go round and round and round on committees. And that is me from the heart, believe me. But I am optimistic, I have to say. Healthcare systems across the world have had to shift. We are having to shift. And do you know, I actually think, having had my rant about change and the culture of change, that certainly at the top there is a thirst for change. What we have to do is make sure it filters down all the way. And that's where groups like ours have such a lot of influence, and growing influence as well. Because it's an awful thing to say, but patients are a bit of a buzzword. I know that as well. You know, oh, well, where are patients in this? You know, they've got the token seat at a table or whatever. But groups like ours actually can put pressure on behalf of patients. So we bring together industry's expertise, patient experience, and we use it on your behalf and patients' behalf. I hope you've enjoyed what we've said today. I mean, I feel sorry for Dan. I mean, you had to do the I don't know. I don't mean dry, but you know what I mean. You had to give this up. Whereas I can say what I want. I'm fine. But please do take away take away hope. Take away that they are streamlining, they are wanting change, and that there is a group like ours that now has growing and growing influence, and people are coming to us and saying, we want to know your view and you want to help. So, and we highlight good case studies. And if you have anything, if you want to come and talk to us, to join us, whatever, please talk to Dan and I afterwards. But it's been a pleasure today, and I'm so pleased so many people stayed. Thank you. And if you have any questions, you know, please ask. Is that right? Was there no questions? I've done my job. Thank you.
I'm sure you're just all a little bit shy, but I'm sure they can catch you afterwards, Barbara. But from us, that's a big thank you to everyone who's attended any sessions this year, because that is the last session of the MedTech Innovation Expo on the conference stage. We hope you've enjoyed it, and we hope to see you back again in 2024. So thank you very much.